Welcome to the Detroit Lions Morning Rounds podcast, also available on YouTube. You can also find this segment on the Detroit Lions on the Prowl YouTube channel, so please subscribe to that. I'm board certified in family medicine. I'm not an orthopedic doctor. I do have a strong interest in sports medicine as well as a lifelong Lions fan. Let's talk about Kenny Golladay in the Colts game. Here's the play that looked like where he got injured. He goes out of frame, so we don't see the actual point he got injured. However, after the play, he flexes his left hip right there. Now, I reviewed the plays prior to this, and I did not see any signs of any injury prior to this. He looked to be at full strength. So this was probably the play that injured him. You can see up in the upper left part of the screen, classic left hip flexion activity right there. He's testing it out. He actually played another couple plays after this before pulling himself out. It's a good sign that he didn't have to go to the ground. He was able to bear weight, did not need any help to leave the field. This hopefully suggests it's a mild strain, although there's no way to say for sure. Julio Jones had a mild hip flexor strain in 2017 and was out for 2 weeks. I would expect the same with Kenny Golladay, that he'll miss this week's game against the Vikings, hopefully be back for the Washington game after that, although it could be even longer than that. Worst case scenario with this injury would be a hip joint injury, something involving cartilage, which does not heal well, if at all. A hip joint issue is what is thought to have derailed DeAndre Levy's career. But I'm suspecting most likely this is a simple muscle tendon strain of the hip flexor. Let's move on to Halapoulivaati Vaitai. Fourth quarter, this is the play that severely hobbled him. You can see after the play, he can hardly put any weight on that left foot. Now, I don't have any idea what's going on with his left foot. Remember that he injured his foot in training camp and missed the first 2 weeks of the season. Not sure which foot it was at that time, but I'm going to guess it's probably the same foot. He had to miss the first 2 weeks of the season due to that foot. He was also out much of the game in Jacksonville, although that was reportedly due to dehydration, but who knows. So this foot may have been something that's been bothering him for a while. Now, I reviewed previous plays to this, and I saw that in the third quarter, he was also hobbling and also looked to be not at 100%. Look at this play right here. This is in the third quarter, 8:47 mark. After Swift gets tackled, he drags his left foot behind him. It's a subtle thing, but look at this again. Left foot drags behind him. He doesn't fully lift that left foot up, and he doesn't pull it past his right foot. Right there, that step right there drags a little bit. And then after the play, he hunches over a little bit, a couple times right there. And then right there, possibly showing that that foot is bothering him already at that point. So I'm suspecting the foot was bothering him much of this game. That may explain his poor play during this game. It may explain why the offensive line looked the worst it has all season. Crosby ended up replacing him a play after that play in the fourth quarter. So in retrospect, they may have wanted to play Crosby earlier in this game or started out with Crosby. Now, I think there's a good chance that Vaitai goes on IR, which would knock him out for 3 weeks at this point. This foot clearly was bothering him all game, may have been bothering him for much of this year. He probably needs some time off. In addition, Crosby has been playing very well this year. So I think Vaitai needs some time off, get this foot right before it becomes a more long-term or chronic issue. Now let's take a look at Jamal Agnew. This is the play in the third quarter, 5-minute mark. He gets tackled, thrown to the ground, hits the ground pretty hard, comes up looking totally fine. Doesn't show any signs of injury there. However, as he's walking off the field, he starts reaching up towards his left chest area, then doubles over a little bit. Then the trainers come to check him out. So let's look at the impact point where he hits the ground, which is right there. You can see that he's holding the ball high up on his chest with his left hand. And it looks like he may have landed on the ball right there. So that suggests to me a rib contusion or possibly even a rib fracture, neither of which is any severe injury. Even a fracture, NFL players can play through that. I'm not expecting any significant injury here. I think there's a decent chance he'll be back this week for the Vikings game. All right, so that's the injury report for the Colts game. Find me on Twitter at Jimmy Liao MD. Feel free to leave comments on my YouTube channel. Thanks.